Hey guys, it's Emily. I chose liver cancer because I know somebody that had a personal experience with it and I think it's interesting. So let's get started. The liver has many functions. It's used for blood coagulation, filtering and detoxification of the blood that passes through the body, vitamin D synthesis. It helps regulate temperature when you're resting, creates cholesterol, things like that. So there's many different types of cancers, but these are just three common ones. The hemangioma is a benign tumor of the blood vessels. There's not really any symptoms or treatment required, but if it starts to bleed, you can have it surgically removed. The hepatic adenoma is also a benign tumor. It occurs within the actual specialized liver cells called hepatocytes. It can cause abdominal masses and pain, blood loss, things like that. The biggest risk is rupture. It can also be surgically removed. The hepatocellular carcinoma is the big bad one. It has small nodules throughout the liver, as you can see in the picture. It's most often seen as a progression after cirrhosis, and it's the most common malignant tumor in the U.S. So for symptoms, in the early stages, you don't really have symptoms, and if you do, then they aren't anything major, so it's often confused for other things. Some of them are abdominal pain, nausea, vomiting, fatigue, weight loss, things like that. In the late stages, you might see white chalky stools, a fluid-filled abdomen, yellow skin or pigmentation in the sclera of the eyes, and severe pain. So as a nurse, you're going to want to get a full history. Make sure you know all the surgeries they've had, the diseases they have, any drug history, medications they're on, stuff like that. You're going to need lab work, which we'll talk about in a minute. You can palpate the abdomen, but deep palpation is for the physician, so just be careful with that. You're going to want to complete a pain assessment and document any other complaints the patient states. So a lot of people want to know how it happens. So liver cancer doesn't have an exact cause, but there's a collection of risk factors that can lead to it. Cancer itself is an uncontrolled growth of a bunch of normal cells that create a mass. They can result as a result of many things, like just medications that people are taking, pre-existing infections like hepatitis, disease processes like diabetes, and social habits like drug abuse. So liver tumors can make hormones that affect the rest of the body and may cause lots of other things to go on, like blood sugar changes, problems with red blood cells, cholesterol, stuff like that. So we're going to do a series of tests because most of the time one thing isn't definitive. The alpha-fetoprotein blood test is one of those that they use, but it can determine lots of other things, so it has to be used in conjunction. On the right of the screen, you see a picture of a biopsy. This is what they do to determine malignancy or infection or just see what's actually going on. In the picture of the CT scan over here, you see a tumor that has enlarged, and it just shows the different sizes. And some of the labs are listed. You definitely want some blood studies, liver studies, proteins and cholesterols, baseline electrolytes, sugar, things like that. So cancer is staged by TNM, so that would be the size, if there's any nodes involved, and if it's spread throughout the body at all. The top picture just shows how a healthy liver goes to liver cancer. It starts getting scar tissue and then becomes cirrhosis. And the different stages just depend on where in the body it's located and how far it's spread. And it usually starts with some sort of acute infection, becomes chronic inflammation, then there's scarring, it becomes cirrhotic, and then full-blown cancer. As far as treatment, they can be surgically removed, you can be put on the transplant list, you can try a combination of chemotherapy and radiation. All of this is dependent upon each patient. It depends on their tolerance, the size of the tumor, how far along it is. Lots of different things determine the treatment plan. Most people, because of the fact that symptoms don't show up until late stage, they don't really have a lot of time. by the time they realize what they have. So several people opt for the palliative care. And this document is just showing their survival rates as compared to people without the disease. And basically, you can just see that they're better in more localized areas. So the more it's spread, the worse you are. So some medications, Nexavar, it's a kinase inhibitor. Basically, what these drugs do is just control the abnormal cell overgrowth. It just keeps it from spreading even further. It definitely doesn't cure it. It doesn't get rid of it. Just keeps it from, hopefully keeps it from getting bigger. However, these drugs are very expensive and they have to be monitored really close because they can be extremely toxic, especially if patients are on other medications and things and are immunocompromised. So it's a really difficult process to go through. As a nurse, your most important priority is going to be the support and love for your patient. So you're going to want to make sure that regardless, you're just there for them, and whatever decisions they choose to make, you respect those. And oftentimes it can get difficult because the family may or may not agree with those, but you just have to do your best and do what's right for your patient. You're going to want to encourage nutrition and keep them from drinking alcohol and smoking cigarettes as best you can, and just have like a healthy lifestyle and a better quality of life for as long as possible. And you're also going to want to report any new or worsening symptoms. So these are my sources, and thanks for watching.